Okay, this one's better. All right.
Better?
Yeah.
Okay. So I have to speak to this?
Yeah.
thing? Okay.
Yeah.
So I'm Aida Chavka. I am a dentist and I own Chavka Dental Center. I'm going to talk to you.
Yeah, that's fine. You don't have to look at
Okay,
me.
that's better. Yeah,
Alright.
that's better.
Okay, my first question is, how did you get into this field and what made you open up your own dental center?
Okay. I did not ever plan on being a dentist. That wasn't really my plan. I went to college to study international relations. And when I started taking it, I found it to be pretty subjective, so I didn't really like that. So I decided to do more something in the medical field, and I became pre-med / pre-dental. So what that led me to in the long term was that I kind of steered toward dentistry more and more. So I did dental school, and then I did a residency, and I worked for for a dentist for about 2.5 years as an associate. And I found that it was limiting, and I couldn't really treat my patients how I would want to treat them. So I decided to open my own office.
Okay. How would you describe a typical day or week on the job? And can you please give me a brief description of your duties?
Okay, so that is a good question. But my duties, because I'm both a dentist, but I'm also the owner, I do a lot of stuff. So my duties are obviously to be the dentist. So I treat my patients. I also see all the hygiene patients and examine those. But separately from that, I do a lot of administrative duties. I do payroll, I pay my bills, so a lot of stuff that the front desk does, I do it as well. There's certain things that I keep to myself and I do myself just to kind of know how the business is doing. So Mondays are usually busy because I do a lot of payroll stuff and I do bills and all that, so that's pretty much it.
What are the most satisfying aspects of your job?
Helping patients, that's definitely it. I'm seeing some crowns right now, so there's a patient who we did front 4 teeth, and she really likes the way they look, and it's just a great improvement in her overall daily life. But obviously we also, we remove infection and cause people to get out of pain, which is huge.
Okay. Are there any frustrations or drawbacks you experience in this position?
I think the only real frustration we ever experience are either finances or issues with insurance. So insurance is a little bit of a difficult thing. They promise patients more than they provide, and they don't pay for treatments like they should. They're a little behind. So they don't always pay for the most up-to-date or recommended treatment, which can get frustrating. But working around that is frustrating as a business owner because I have to employ probably 2 to 3 more people than I would on average just to deal with insurance, because we have to file the claims, we have to look it up, we have to submit it, we have a lot more work to do. If we didn't have insurance to deal with, our lives would be a lot easier, but it's as a courtesy to the patients.
Okay. What skills, personal traits, or values do you believe are necessary to be successful in this occupation?
I think you have to be honest. I think that's number one. There's a very easy way to mislead people, to misdiagnose, and to do something that you don't think is 100% correct. So that's number one. I think I stick to that because it helps me sleep at night, so I don't have worries when I go home. That's number one. You have to be a people person. You have to like to talk to people and meet people. If you don't want to do that, you can't do well in this job, because I probably see 30 to 40 patients a day. So if I don't want to talk to them, I'm not going to be very successful. And you have to be very detail oriented. You have to be a strong leader, so to say, to be able to run the office and be the boss at the same time as being the doctor. So that can be a little complicated.
Okay. And how does your career affect your lifestyle?
While in the medical field, they always say that the dentists have the best lifestyle. They always say that because most of us we work kind of set hours. We don't take emergency calls. We're not stressed by those details. So that's usually an easy thing. It's fairly easy and fairly good. It is stressful and it is a big obligation. So you do worry about the money details. I mean, we have a room that's being built out. So it was being built out on Friday, and I work on Saturday. And I came in early because I knew I had to vacuum and make sure it was clean. So that's the kind of stuff that you take on as an owner.
Okay. What do you wish you had known about this career before you entered it?
No, I'm not sure I know. I think I was pretty well prepared.
Okay.
I shadowed a lot of dentists and I kind of knew what the story was about, so I knew what to expect.
Okay. And what advice would you give to a young person entering this field?
I would say that you need to shadow, and like I told you before, you need to
Mhm.
shadow, and you need to watch what it is day to day, and you need to imagine whether that would be something you're good at. I think also the difficulty is knowing if you're good at dentistry. It's one of those fields where you have to spend a lot of time to prepare for it, and then when you get into it, I saw a lot of my classmates who just weren't that good at it. No matter how much they wanted to, no matter how smart they were, they couldn't perform. So you have to make sure that you're crafty or artsy, and you have kind of a easy way of working with your hands. And that's a good way of preparing yourself. So that's why they care whether you're playing instrument, whether you know how to crochet, whether you paint, all those things, because all those things take some finite hand movement. So that helps.
Okay, and then my last question is, I know it's in the medical field, but do you travel for the job?
I do travel for the job, so
Okay.
I don't travel to treat patients. That's something that is a little constricted by your malpractice insurance and by location and all these things of what you're allowed to do. But the main traveling that I do is for continuing education. So in any medical field, you have to get continuing education hours and you have to learn. And being that I'm in Jacksonville, it doesn't mean that the best educational opportunities will come to me. So I have to travel to make that happen. So in a few months ago, I went to Boston and I spent a few days there, but I routinely do that.
Okay, well, I want to thank you for taking the time out of your busy schedule to meet with me and so I can learn more about dentistry.
No problem.
Okay.
I'm glad you came.
Thank you.